Hello, my name is Laura Humphries, and I am a Senior Clinical Specialist for the Intersocietal Accreditation Commission. The purpose of this webinar is to provide additional information about delayed accreditation and what you can do to prevent and rectify delay. Today, we're going to talk about the application process, application decisions, common reasons for delay, available resources, and submission of delay materials. The application process consists of these steps. First, the facility prepares the application. It's submitted to the IAC. The application goes out to 2 independent peer reviewers. Their comments go back to our board of directors, who ultimately make the accreditation decision. 2 decisions can be made. The facility can be granted, which means you are granted for a 3-year cycle, or delayed, which means additional evidence of compliance must be submitted. This does not mean that you were denied. This just means that we want you to raise the bar a step ahead. Common reasons for delay, things you want to avoid. Case study selection is one of the big ones. Limited exams. So if you have case studies that require bilateral exams, submit bilateral exams. If you have a patient that was difficult and maybe you couldn't see all the vessels, while we understand this is real life, don't submit those cases to us. We want to see your best work. You must submit abnormal exams, so do not submit normal exams, and make sure you're choosing the correct case type. If you have any questions about any of these, I encourage you to call the IAC, speak to one of us, and we'll talk you through it. Another common reason for delay are inaccurate reports. Physicians do not adhere to the criteria. You want to make sure your reports reflect the criteria exactly as it's written. If your criteria says 50 to 69%, make sure your report says 50 to 69%. It can't say 50 to 79. Also, make sure it is reflecting the category that it should. Another problem is missing complete findings. If a patient has a bilateral DVT, make sure it's reported bilaterally. If they have a cyst, make sure that's documented on the final report. Another problem is disparate findings. We have a lot of laterality issues where the findings may document right leg DVT and the summary will document left DVT. We also see a lot of typographical errors with velocities or ABI and such. So just make sure you look over your reports with a fine-tooth comb before you submit them to us. Another common reason for delay are non-compliant QI. And those case studies that you submit to us, if you use your online QI tool, you should be able to identify deficiencies before we do. So we encourage you to use this tool for your case studies that you're selecting to submit in your application. Now, you are required to do case assessments now as opposed to your correlations. This has been implemented for quite a while now. You can do these as self-assessments through your online tool. And if you have any questions about that process, you can certainly call us. Your QI, you should have 2 meetings per year, just as it's always been. And those QI minutes should reflect the case reviews and the results of those findings. We encourage you to use your resources. You have your application review findings document, your decision letter, and you have the IAC staff, which is your most valuable resource. Many times people will get their decision letter, they will get panicked, and they will call us immediately without looking at all the documentation and kind of taking in and evaluating exactly what we need. The application review findings is a vital document. This will provide information case by case so you can see the reviewer's findings and exactly what they meant when they thought that your application should be delayed. This reviews the strengths and weaknesses of your facility as they relate to the standards. To view your application review findings, you need to log onto your online portal. Your decision letter is also in your online portal and can be found in the same place. You will click on the Applications tab, then select ARF and notification letter icon in the Available Actions column, this little piece of paper that has all the information that you need. The decision letter will document either that you're granted or that maybe there are some deficiencies that you need to rectify. It's very clear for each testing area. It'll provide bullets and it'll show you exactly what your deficiency was, followed by how it can be rectified. Each bullet has a corresponding bullet to tell you how to fix the issues. Now, if this is still vague, we encourage you to go back to your application review findings to get a little bit better understanding of what these deficiencies mean. What should be submitted for delay? All documentation requested in the decision letter. Don't ever submit partial documentation, because if we need to review your application multiple times, that could result in additional fees, and you certainly don't want that. What you should not submit is documentation that's not specifically requested. If we ask for one case, don't send 4 cases. Don't add insult to injury. If we ask you for a protocol, one protocol for carotid, we don't need to see your protocols for carotid, arterial, visceral, etc. Only submit the documentation requested. In this case, less is more. How do you submit your additional material? You don't go into your online application anymore. Your application is now locked once you've gotten that decision. So all your documentation should go through hard copy through some traceable carrier. Do not email us the information. Don't fax us the information. Just send it all hard copy. Once your delay material is received, it will be peer reviewed once again, and you will get notified of your decision within 30 days. Usually it's much quicker than that, but we'll say 30 days. Again, if you have any questions, we are your best resource. Please call us. The 3 of us can help. We are a team. We can give you any information that you need, and we are available via email. You can send us a chat through the online website, or you can give us a call. This concludes today's presentation, and I thank you for joining me today.